Good afternoon. My name is Chuck O'Neill. I'm Deputy Executive Director at the Kentucky Board of Emergency Medical Services in Lexington. It is October the 28th, 2021. I'm sorry, it's October 27th, 2021 at 2 p.m. Eastern Standard Time. We appreciate you joining us today for this KBEMS EMS Administrators Conference call. At this time, I'll turn this over to Executive Director for the Kentucky Board of EMS, Mr. Michael Pointer. Mike?
Thanks, Chuck. And I think you meant to say January 27th, but we're all good. Just a few quick topics from me, ladies and gentlemen, just some updates on what we've got going on. I've been reaching out in the last few weeks to EMS directors across the state just to see what the status is on vaccinations for your staff. And it appears that we're having good success with that. I've had no services to say that they're having challenges. If you are having challenges with getting your staff vaccinated, please reach out and let me know, and we'll try to make arrangements to assist you with that. We are ramping up. Last spring, summer, fall, we did a lot of testing. Now we're ramping up for the vaccine process itself. I think the governor will be announcing for large volume vaccination facilities, I believe, tomorrow. They have asked EMS to have support on site. Now, this will be for the state-run facilities, which will probably be in the urban areas, most likely, Louisville, Lexington, Northern Kentucky, possibly Bowling Green area initially. As time goes on, they'll be breaking off to smaller county-run facilities. But this is a FEMA-funded operation, and I've been told that they will reimburse in a very timely manner, that they will only be paying for overtime, though. So your on-duty crews will probably not be utilized for this project, and that will keep them out in your jurisdiction. So if we pull folks that are not on duty, they will be getting overtime if they put their time in already with that. So as time goes on, we'll be reaching out to you in specific areas to see what you can offer and see what we can do to help the state and FEMA push this project on faster. Next item, I know a lot of services have protocols, medical protocols that you sent in for changes or updates. And I know, and I'll take responsibility, we've had a backlog on that for a number of months. Dr. Martin, our current medical advisor, has been tasked a lot more responsibilities in her full-time job. We are in a process right now of executing a new contract with Dr. Walt Lovers, and he has assured us that he will be acting fast and swift on this. So hopefully, if you've got medical protocols that are outstanding, that we'll be able to get those processed in a timely manner. I know, looking at the numbers for our isolation and quarantine personnel, I think Paul might be talking about that a little bit more. So that's pretty much it on my end that I'd like to pass along. I think we've got folks with different reports to give you an update. So with that, I'll turn it over to Paul Phillips. Paul?
Thank you. So yes, I will start with the personnel accountability report. So I actually have, I guess, good news, not for those of you who are isolated or quarantined, I guess, but we are trending downward, as we're seeing a lot of numbers in the state trending downward, and I would love if we could continue this trend. EMTs currently have 36 statewide. AEMTs, we have 3, and we have 26 paramedics. So I think that's a total of 65 at this point. That's much better than, I believe, 2 months ago we were around 200. So and that is not with everyone reporting. We've got 130 agencies that are reporting, and that's pretty much a normal week for reporting. So if you're not either not receiving, or if you're not filling that out, I encourage you to do so. We do track those numbers, and some of the decisions that we've made as far as staffing and staffing models have been responsive to those. So yeah, we'll just keep up the good work. I can't say enough about how much we appreciate you guys and the work that you're doing, and that your staff is doing. It is, I don't think any of us thought that going into February of 2021 that we would still be in the situation that we're in, but we are, and you guys are doing an amazing job at continuing on the work that we do. So tomorrow, I want to announce, some of you have asked questions, a lot of questions, and I understand about the block grant and the process, the application, what can we buy, just general questions. So tomorrow, I just sent it out about a half an hour ago. I'll hold an office hour from 11 to 12, and this can be opened up more, perhaps as early as Friday if we need more time. But I'm going to hold office hours and answer questions. Chuck and myself are going to be on Teams, and we'll answer any questions that you have pertaining to the grant process. Now, I want to throw out a caveat. This is only about the current grant process. I just want to make this time about those folks. If you have questions about the previous grant process or the grant cycles, you can ask those separately. So I do want to also update on the renewal and inspection process. We changed a little bit of it this year. It's not going to be a huge change as far as content, but maybe in the process. So this year we are requiring payment prior to each agency accessing the actual application or the upload portion of the application itself. So you'll have to submit payment. So with that said, those of you who have to request a check, or you have to get a approval from the fiscal court, we're asking that you go ahead and do that now. And for all of you, if you could go ahead and make your payment as soon as possible, that way you can get access to the application, and then we're not trying to chase people down towards the end of the year. It just makes everybody's process a lot easier and simpler. Also, we are changing the way we distribute the K-beams decals this year. So we will be sending those out once the agency inspection is complete. We're going to mail those to you. We will distribute those, and that'll allow us to kind of control that process. We just ask that that when you receive it, you remove the old sticker, or you can place it on top of the sticker that you've got now. That's at your discretion. I know some folks are picky about that, and I understand your rolling billboard, which is your ambulance. You want to keep it a certain way, and that's completely understandable, and that's why we're leaving that at your discretion. As Mr. Pointer stated, we are assisting the state-run vaccination sites, and there are several that are going to be coming up soon, and we've been tasked with trying to coordinate, or facilitate rather, the EMS coverage for these. They'll run during the day. They'll run an X number of days a week, usually for 6 to 8 hours a day, and they're asking for EMS standbys for such situations as reactions or adverse effects from the virus, or not from the virus, but from the vaccination. So those, especially those of you who are in larger cities in Kentucky, you can probably be expecting a call from myself or Mr. Pointer, and we're going to be reaching out. We're going to need some help, but as Mr. Pointer pointed out as well, we've been told that FEMA is going to be very swift with payment for this. So hopefully that pans out. Again, that's a FEMA thing. We don't have a whole lot to do with that, but from what we're understanding and what we've been told, they are going to be swift with the payment. So that about wraps up. I hope if you have any questions for the grant cycle, feel free to jump on that office hour tomorrow from 11 to 12 Eastern time. That'll be 10 to 11 Central. So just jump on there and ask any questions you have, and I'll just say it rather than typing it. If you have any questions for us for today, you can go ahead and type them in the chat, and we'll try to get to as many of those as we can with the time we have. That's my report, Chuck.
Thank you, Mr. Phillips. Up next is the Director of Education and Training, Mr. Robert Andrew. Bob, it's all yours.
NREMT has extended their provisional certification through June the 30th of 2021 this year. Provisional certifications will be automatically assigned to any candidate that completes an educational program at the EMR, EMT, AMT, or paramedic level and successfully passes the National Registry Cognitive Computer-Based Exam. The National Registry 2019 EMS ALS Practice Analysis is also available, and you can find it on their website at nremt.org. And they have a new website, so if you haven't been there, just go there and take a look at it. Provisional certifications that they issue will remain valid through December 31st of 2021, or until an EMS provider passes the psychomotor exam before that expiration date. We accept the National Registry Provisional Certification as a regular National Registry certification because we're able to verify the skills through the EMS training center that the student took their course through. So if you're able to obtain your provisional certification from National Registry, you'll be able to apply for your initial certification or license using that card. So there's no need to wait until you complete those psychomotor skills before applying for certification or license with our office. EMS providers that hold a temporary certification or license from K-Beams need to complete their NREMT certification testing prior to the expiration date listed on the temporary certification or license. So if it expires on January the 31st of 2021, then that temporary expires at that level. There's no automatic reversion back to a previous level if a person held a previous level. An example would be, I have a temporary AEMT and I upgraded that from my regular EMT that I held with K-Beams. The EMT that you previously held or that person previously held does not exist anymore. We only see one certification or license level at a time. So they're an AEMT in our eyes. Just happens to have a temporary assigned to it to bring attention to the date, because the date is different than our normal certification cycles. So just make sure that if you're going to expire, that you complete the registry testing and apply for that full initial cert or license before your expiration date. Now, if you can't make that transition and you previously held a certification or license with us at that lower level, we have an application in CHEMSYS. It's called a downgrade application, and you should complete that no later than 2 weeks before you expire. I would probably look at doing it 3 weeks out just to be safe, and we will change you back to your previous certification level, and your expiration date would be set for that current year. So if you did a downgrade application today and we process it and you were an AMT, you would then drop back to your EMT with a 12/31 of 2021 expiration date. Just checking my notes here. We're also in the EMS TEI renewal process. EMS TEIs that were due to renew by March the 31st of 2021 received an email that they're up for renewal. Well, unfortunately, our system queued up every EMS training center instead of just the ones that were expiring. So I'd just like to put out there, if you got this email, everyone did, and your TEI doesn't expire until next year, you don't have to contact me. You're good to go. You received it in error. So if you're able to determine that your TEI through public lookup or your certificate states next year, there's no need to contact me about that correspondence that you got. The instructions on how to renew were in the correspondence and also can be found on our website. There's a special banner running right now, EMS TEI renewal, which has a list of the EMS TEIs that are up for renewal for that March 31st, 2021 deadline. Another thing about our move, when we moved offices, is we're still unable to print cards at this time. We expect to be printing cards about mid-February. So everyone receives an email about their certification or license with a PDF copy of the card. Everyone's KEMSIS account should contain a PDF copy of their certification or license as well. You can go in and download that if you need one to print and have with you. If you want to verify someone's certification or license, you can always go to the verification link at the top of our web page. It's at the very top above our name. It's kind of hard to see, but you can verify through that. Or if you're an administrator, you're able to do that through your personnel rosters and check for expiration dates and certification levels. We have continuing education available on our website, as we mentioned before. It's under education in the gold banner. So you go to our website, kyems.com, click education in the gold banner. On the left, when you click on continuing education, about midway down that page, you'll find the Jones and Bartlett Learning continuing education modules that they built for us. They consist of the core components for each of our levels based on regulation. It doesn't contain any of the elective items, and it's for $1 credit hour, which is very good. We have right now a free Prodigy EMS 30-hour NCCP NREMT refresher. It's on demand and it's fully accredited by CAPC as well, and it's free. And I believe it's running through March. I hope they run it past that, but I think it's set to run out in March to correspond with registry's renewals. The sexual violence awareness training course, we're working on that to get that online and train. Looks like now it's going to be late 2021. We were anticipating early 2021, and we're just inundated with unexpected COVID emergency workload and other things, and it's gotten pushed back. So that's going to have us push that requirement back to 2022, where we won't be validating that as a required training until the 2022 renewal cycle. So that'll give folks plenty of time to get this course. We want to get this online for free and readily available to folks before we start requiring it. So we're looking at 2022 now. Another thing to be aware of, Castle Branch is our national background check provider, and they mainly do the background checks for anyone applying for initial certification or license with us. Once you're in our system, then we use the Kentucky Administrative Office of Courts background check. But prior to that, your entry, you go through an extensive national background check, which has some special items on it that's not found in a normal background check that meets our requirements. One thing that's occurring is due to the COVID-19 emergency, there's been a lot of courthouse issues in Kentucky and across the country, closures, limited staffing or access, as well as these vendors not having access to the computer records like they used to because of these closures. So we're working with Castle Branch to expedite these whenever we find out about them, or Castle Branch is able to determine there's a delay, they'll notify us. So you administrators know that when you have folks that are being held up from that we have already determined with Castle Branch a process that if an individual background check is being held up by a county in Kentucky and it's from the COVID-19 emergency closures, then we will ask them to cancel the county check and use the statewide check in lieu of that. However, there are some cases where the individual's records indicated in the search, there's a national record indicator. And in that search, they might find something that requires them to look at the county level. When that occurs, we let that run through the process. So you could have some individuals that are going to have some extensive delays in getting their cert and license due to that. But thankfully, that's an extremely low number there. We're talking, less than 5 people. So we are working with Castle Branch closely with these cases to try to get them through as soon as possible. We're still operating under our COVID-19 emergency regulations. The personnel certification licensing requirements, of course, have been amended along with our checklist. So if you have any questions about how to change things or get certified or anything like that, go to our website, kyems.com, click on the COVID-19 Health Alert, read more, and you'll find all of the checklists and the emergency regulations there. And lastly, the support portal is the best and fastest way to communicate with us. We answer those daily and monitor those constantly. Phone calls and emails are not the best way to communicate with us right now because of our tremendous workload that we have. So the support portal is going to get you your fastest service. And that's all I have, Chuck.
Thank you, Bob, for that update. We appreciate it. Up next is Drew Chandler, the KBeam's data administrator. Drew?
Thank you. Hello, everyone. I want to start off with an update about NMSIS version 3.5. Last summer, the KBeam's Data Committee and the board adopted a timeline where Kentucky would begin transitioning to the newest version of NMSIS, that being 3.5, starting this month, with all services transitioned by January of 2022. Like many items delayed by the pandemic, the developer of our K-Stars software has pushed back their release to June of 2021, partially due to development issues with remote working staff and also the growing queue of software that is going through NMSIS testing and compliance checks. As a result of that, the Data Committee last week recommended a change to the board to have the transition completed by July of 22, pushing back 6 months, with the last acceptance of NMSIS version 3.4 going from July 22 to October 22. So I'm posting the link in the chat for those of you that have the Zoom interface up. You can see this new timeline. It makes it a little easier to visualize. But we also have this new timeline published to the KBeam's website under the K-Stars heading in the gold navigation banner. And so you'll continue to hear more messaging from us and your agency's EPCR developer as market availability of NMSIS version 3.5 software expands to become the norm. The second item I want to bring to your attention today is the Universally Unique Identifier, or UUID, which is a new field that's part of NMSIS version 3.5. The UUID is a system-generated alphanumeric code for the agency, vehicle, provider, and the patient encounter that, when those data points are combined in state repositories like KSTARS and the national NMSIS repository, they have a statistically improbable chance of being duplicated. The goal of the UUID is to simplify the record linking process between databases such as NMSIS, cardiac arrest registry, trauma registry, patient registries, and others. Unfortunately, the owner of the National Trauma Data Bank removed emergency medical service fields from their database starting this year in favor of linking records by use of that UUID. The National Trauma Data Bank, or NTDB as it's referred, is the data standard for trauma registry software used by medical facilities. The reason I bring this up is that recently several of the state trauma centers have reached out to ambulance services to obtain your agency's UUID so that they can populate their trauma software. And as you learned in the last segment, Kentucky won't be on version 3.5 where the UUID comes into play until this summer at the earliest. Our colleagues on the trauma side and hospital association plan to help with messaging the contacts so that your agencies aren't bombarded, but I wanted to bring this to your attention in case you get any calls on it. And that concludes my report.
Thank you, Drew. We appreciate that update. Up next is the Kentucky EMS for Children Project Director, Morgan Skaggs. Morgan, if you can unmute yourself, you should be able to speak to the group.
Okay, thank you, everyone. I have 3 items to discuss with you today. The first is our annual EMS for Children survey. It is currently open. Invitations were emailed to either the agency director or the designated pediatric emergency care coordinator for your service. This data is really important. It's required from our program in order to maintain federal funding. And so we really depend on your help in order to provide that information to Congress so that we have continued support for the EMSC program. So we're looking for all of our agencies to participate in that survey. It is currently opened, as I said, and it will close on March 19th. So we've got about 25% of you have completed this so far. So we've got about 75% to get done in the next few weeks. I know a lot of you have a great deal on your plate at the moment. The survey was intentionally kept as short as possible this year. And so we hope it will not take more than a few minutes of your time. It is also required by our program when we do have programs and initiatives such as equipment giveaways that we check to make sure that you had completed your last annual survey as eligibility to participate. It is also required for the second item that I was going to talk about, which is our voluntary EMS pediatric recognition program. The application window for that program is currently open for 2021 recognition, and it will close on March 15th. We do have a handbook as well as examples of documents and policies that you might want to use if you are going to apply for recognition available on our website. Or you can reach out to me directly and I'll be happy to email those links and documents to you. If you are interested in improving pediatric care, demonstrating your commitment to the children in your community, and receiving public recognition for your work, then this is the program for you. Programs that were previously recognized, we had 24 last year. Keep in mind that this is something that you reapply for annually. And so we'll be looking forward to receiving those applications from both previously recognized as well as those that are seeking first-time recognition. The final item is I wanted to just highlight that our Kentucky Pediatric Emergency Care Coalition meeting, our 5th annual meeting, will be held this year on March 3rd. This has traditionally been very nursing and ED focused. We are trying to expand that a little bit this year. So our EMS directors training officers or pediatric coordinators are invited to participate. The morning sessions will be still ED focused. Afternoons or midday sessions will hopefully be of interest to both ED and EMS, and then we'll conclude with a few things specific for EMS. And we will have that agenda available soon, so you can choose which of those sessions you would like to participate in, because as of course with everything else, it will be held virtually this year. So if you have any questions about any of those programs, I'm hopefully always available to you by phone or email, and would be happy to answer additional questions. But that's all I have for you today.
Thank you, Ms. Skaggs. We appreciate the update from the EMS for Children program. A few updates from my office. The fiscal year 21-22 grant application period has been open since October 2020 and will close on January 31st, 2021, just in a few days. If you've not completed your grant application and are interested in applying for the grant, please complete the application no later than January the 31st, 2021. No late applications will be accepted. Block grants are currently being reviewed by Mike Pointer, the Executive Director, myself, Chuck O'Neill, Deputy Director, and Paul Phillips, Director of Field Operations, on at least a weekly basis, many times twice a week, which is why you may be receiving correspondence from our office on multiple days throughout the week. We are seeing trends in application errors. Many of the errors are common among agencies. Specifically the G4 or accountability of funds for FY 1920. Accountability of funds items on the applications do not match the previously approved items from the agency G2 for FY 1920. So when we do a G2 for 21-22, which is what we're in right now, which is your request application form, you also have to provide accountability of funds that the board awarded you 2 years earlier, which would have been fiscal year 1920. So the items for fiscal year 1920 on your G4 have to match exactly the G2 items that were approved by K-beams for your fiscal year 1920 application. Also, your spend, the fiscal year spend, all items that were previously approved or all items that are approved going forward must be purchased with a proof of purchase, such as canceled check, credit card statement, or other form of payment must be uploaded to provide proof of expenditure. So for instance, for your G4 for FY 1920, that's within this grant application period, we would need a canceled check, a credit card statement, or other proof of payment. An invoice, a packing slip, does not show that the funds were expended towards a vendor or for a specific payment. So we do need much more specific information on payment in order to meet our financial regulatory requirements. Also, agencies may not substitute items previously approved by the Office of the Board unless a properly executed and approved G3 application for item change application has been completed by May 31st of the fiscal year of award. For instance, for fiscal year 2021, the deadline for G3 substitute item submission is May 31st, 2021. For 1920 fiscal year, the deadline would have been May 31st, 2020. You can't substitute items after May 31st of the fiscal year of award. From a regulatory standpoint, we're currently working through administrative regulations, amending the data regulation, changing gears a little bit. We're amending the data regulation, education regulations, and regulations on fees, community paramedicine, and wilderness paramedic. This work is going to be ongoing, and we encourage all agencies, directors and providers and professionals to participate in these meetings. All meetings will be posted on the K-beams events calendar and will be held virtually until further notice. So we'll go into a question and answer session now, and we'll be glad to answer any questions that you have. If you don't have any questions for us today, we appreciate that that you're continuing to work hard and that your staff are continuing to work hard through this pandemic. We hope that through the vaccination and herd immunity process, that we'll be able to see each other in person in the coming weeks and months. But we do appreciate all that you're doing. We will try to address any questions that you have in the chat feature. Paul, I believe, is going to be having office hours regarding the FY21-22 grant applications tomorrow, and we'll probably have one as well on Friday if we can fit that in. Paul, if you can unmute yourself, we can take some questions from folks.
So the first question comes from Troy Walker, and I believe I'll field this one. It's, can we get the invoice by request for the inspection? Cannot process payment without one. So Troy, you can do that within the application, I believe, and Drew, correct me if I'm wrong. But I believe the first page is where you will submit your agency information, and at the end you can indicate whether or not you need an invoice. And once you submit that, then it either goes into, well, it automatically goes into the payment portal or the checkout feature there in KEMSIS. So I believe that's how you would get the invoice. All right, the next question, and I'll field this one as well. How do we apply for the FEMA payroll reimbursement? And this comes from Marietta Worth. Marietta, this is not just a general payroll reimbursement. It is only for vaccination, the state-run vaccination process, and it's only for those that are set up through the state. And we'll be reaching out to some of the agencies in the larger areas. I think those are only going to be for the regional sites. There's more. This changes every day. Mike and I are on a daily call with these folks, and some of the information's changing very quickly. So we will be reaching out if we need any help, but believe me. All right, the next question comes from Carlos Coyle. Drew Chandler, I believe you'll be able to help with this one. Is there a way to separate KBeam's KEMSIS accounts? I am one of the many directors that receive KBeam's agency emails on my personal account. Some emails come to my personal account, some to my professional account, and some to both. Thanks.
There's a long answer and the short answer. And the short answer is yes. You can go into your KEMSIS profile and create a secondary contact where you could use your agency telephone and email address, and then you can assign that contact profile to the agency and even the TEI, or maybe those are different. The long version of the answer is, if we send mass communication in a certain manner where it doesn't originate from the agency's account, you may still get correspondence on the main email address on file. We've had varying success with that. It's on a long-term roadmap for our developer, but it does exist to some extent. So if the communication originates, maybe you're doing your inspection and service renewal, or adding a vehicle, maybe you've got an addition to the fleet that needs to be done, protocols and that sort of thing. Those would respect the contact profile that you make on your KEMSIS account. But if we do a blanket email to all directors, that's not actually tied to the agency account. So it would still go to the main email address. And I'd be happy to help anybody with that offline if you want.
If it makes you feel any better, Carlos, every time anybody in the state submits a grant application, me and Paul and Mike get 5 emails apiece, and you multiply that out by agency if you like. But we are trying to work on that. It's just something that we've been working on the software developers with for quite a few years, actually, and we continue to work on.
So Chuck, I believe you can field the next question. It comes from Chris Gilly. What if you did not receive the grant in 2019, 2020? I guess that's the FY20 period.
Right. So, Chris, if you didn't receive a grant for 2019, 2020, you can either notate that in your G4 application and submit it. which is probably what would be preferable, is to just note in your G4 application, did not receive funds for 2019, 2020, and you will not be held responsible for accountability of funds that we never awarded to you. But it does need to be complete in the application. What we found when we did an audit of the 2020, 2021 applications is that many agencies that did not receive funds the 2 years prior just failed to even start the G4 application. When you don't even start and submit the application, there's nothing for us to review. It just shows that it's incomplete. So it would be the same as if you didn't even start the application. So log in, do your G1, your G2 for 21-22, and for your 19-20 G4 accountability of funds, just notate within that application that you didn't receive funds, hit submit, and we'll catch it when we go through the committee reviews.
The next question comes from Kathy Rigney. Do you have any updates on the KY NEMT Logicare?
Kathy, I'm actually having a meeting with Troy Walker, the president of the Kentucky Ambulance Providers Association, and Logisticare on Friday. And those updates will be coming through, not through K-Beams, but through the Kentucky Ambulance Providers Association. So I'm not sure if your organization is a member of CAPA or not, but they are monitoring the Logisticare situation. The only reason I'm getting on the call with them is to provide some state-based information that they may need as far as I'm not sure what information they need other than possibly some demographics for agencies, but I've talked with Troy, and Troy's probably on this call as well, but just plan on those updates on Logisticare and non-emergency medical transport reimbursement coming directly from your representatives with the Kentucky Ambulance Providers Association.
Okay, next question, and Jonathan, I don't want to butcher your last name, so I'm just going to call you Jonathan. It says that requires a document for that part. Will a memo suffice for that G4 number 2 section? And Chuck, I'm not super familiar with the entire application there. Do you know which part this is referring to?
I would have to pull it up, and I don't have ImageTrend pulled up in here to look at one. Actually, if you can go to the next question or field the next question, I'll open one up and take a look at it.
He says down here, this is RE regarding no funds from last grant period.
Yeah, I think we worked to modify the application to put that no funds were received in FY 1920, but if it's not, then a memorandum from yourself that no funds were received for FY 1920 will suffice, and we'll catch that during review. Main thing we need you to do is make sure the G1 and G2 are correct, and make sure that if you didn't receive funds in FY 1920, that we know it through your application. We're managing everything through applications. It's an immense amount of documentation and paperwork, and it's all electronic. And we're definitely not asking you guys to feel sorry for us, but we're managing all of these. So when we get a support ticket on a response, an email on a response, a text message on a response, and a phone call on a response, we're getting that for 220 agencies, or 200 agencies. So we want to try to keep it within the application. So if you can complete that within your G4, submit that to us so we can keep everything within the application for tracking purposes. It makes things a lot easier, and the easier it is on us to process these, the quicker you guys are going to get money.
And also keep in mind that when we ask, that is in reference to the grant period from 2 years ago, not last year. It's the grant period two years prior. I know those fiscal years are confusing. If you saw the whiteboard in the meeting room where we review grants, you would understand we have to map it out for ourselves as well, because we get confused even within ourselves. We don't have any further questions right now. Troy Walker did share some further context on the Logisticare. He said, we will allow others onto the call, and we'll share the link for that meeting with K-Beams if needed. Not the Friday call, but we'll have a Logisticare, call for all services next week. So that's a little further context on that. And if anybody else has any further questions, feel free to drop them in. We've got about 15 minutes left in the hour, and we're glad to help.
And Paul, I'm not going to be able to be on that Teams call with you tomorrow for office hours, but if I'm needed for anything, we can do another one on Friday if need be. If you've, regarding those office hours though, if you have called, text, left a voicemail, emailed us, etc., within the last 2 hours on a block grant question for 21-22, if you can jump on the office hours tomorrow and get your question answered, then it will free us up to get back to some other things that we can concentrate our time on the grant during the period of time tomorrow, if you wouldn't mind. We're still getting, as we've said on this call, I've gotten about 20 emails, voicemails, etc., on grants, and if we can use that dedicated time tomorrow, it would be very helpful for all of us.
Okay, we got one more question. Dale McCreary said, Mike stated earlier, if we have an issue getting an employee vaccinated, contact K-Beams. Who would the contact person be? Thanks. You can reach out to Mr. Pointer. His email is michael.pointer@kctcs.edu. I'll put that in the chat.
And Dale, at a local level, I would contact the Simpson County Health Department and the hospital. If they're refusing to vaccinate an employee in 1A that's an EMS employee, then let Mike know, and we'll try to work with the folks in Bowling Green or something like that and get you guys in down there. And Anthony, Chief from up in Northern Kentucky, asked a question about CEU audits. We did do CEU audits, but those CEU audits were waived due to emergency orders this year. So if you were chosen for audit, there was correspondence and applications that were placed into your account that states that you were audited, but that the audits were waived. The audits are required by statute, but were waived through emergency order because of COVID-19 this year. So there shouldn't be anything that any of your folks, any of your personnel should have to submit for a CEU audit. Chief.
Looks like I'm not seeing any further questions. If you want to go ahead and wrap us up, I believe.
I've got one from Alan Bottoms here on, we had an employee asked to vaccinate after first round were given. Local hospital said they had to go to a regional site. Alan, I believe you're in Campbellsville. Yeah, I believe you're in Taylor County, if I remember correctly. Call the Adair County Health Department in Columbia and see if they can help you out. Don't tell them I told you to call, but call Columbia, Adair County Health Department, see if they got anything they can help you with. And with that one, I believe we've got it. But thank you all for participating today. Paul, thank you for everything that you helped us with. Bob, Andrew, Director of Education, Drew Chandler, Director of Data Administration, Morgan Skaggs, EMS for Children, Project Director, and of course, Mike Pointer, our Executive Director, who had to step off for a Kentucky Emergency Management call. But we appreciate each one of you for participating today. We had up to 110 administrators on the call. It's great that we can get together and share some information. I wish we had more open dialogue. It's just difficult for us to actually have open conversation with 110 people at the same time. But we hope to see you in person soon. Paul, when's our next administrators call? Next month or the month after?
No, we're doing them monthly, so it'll be on February 24th, 2 o'clock. Same bat time, same bat channel.
All right, there we go. So we'll see you all in February. If you need us on anything between now and then, we are having some technical difficulties or technical delays at the office with our office relocation, but we expect to be up soon. We're just operating partly virtually and partly off of MiFi cellular hotspots. So if there's any delay in communication, we apologize ahead of time for that, but we have our staff are all very client focused, and we want to make sure that your needs are satisfied and your questions are answered. So please feel free to give us a call or an email if you need anything. Take advantage of the open office hours on the block grant, and take advantage of the block grant before the 31st deadline. If you haven't applied by the 31st at all, you'll be denied. So please make sure that those applications are completed by the 31st. And we appreciate each one of you. Stay safe, keep your staff safe, get vaccinated. and have a wonderful afternoon. We appreciate you very much.